Hello everyone, and thanks for watching. Today's video is about acne, and I know many teenagers who are very interested in this topic and want a little bit of advice, so here it goes. First of all, the acne is not your fault. It's not because you ate pizza or because you ate chocolate. It's just because of your age, and thanks to the hormones of puberty, which cause your body to produce more oil, there are more bacteria thriving, living on your skin. And then when you get pores that become plugged or blocked or clogged, then the bacteria from the skin can sort of thrive on all that increased oil production. Well, then your body's immune system tries to fight this off, so it brings in white blood cells and makes pus and creates inflammation and swelling. So you can see the causes are multifactorial, and that'll make sense when we talk about the treatments because they're trying to attack all those different causes. So this is not your fault, but there are a few things you can do to actually make acne worse, so you want to avoid doing these things. It is not because you're dirty, even though there are bacteria involved in the process. Everybody has normal bacteria living on our skin. So if you decide, I am gonna scrub the living daylights out of my face, and you wash your face about 5 times a day, what happens is that strips the natural oils, and then your body overproduces the oils trying to make up for it. So over scrubbing, over washing could actually make things worse. Most experts or dermatologists recommend cleansing or washing your face once or twice a day. So if you can stick to a twice a day regimen, that would be ideal. But if you can't, if you just know that's unrealistic, I would at least suggest a bedtime routine in which you do several steps to cleanse and fight acne. Now, other things that you could do to make it worse, in addition to overwashing, if you just kept your hands on your face or anything on your face that's gonna trap and increase oil production. So I can remember when I was a teenager, maybe taking an exam in class, I might rest my face on my hand or have my hands all over my face. That's not a good idea because that could plug those pores even worse and cause increased breakouts of acne. So I do want you to eat healthy food when I told you it wasn't pizza or chocolate's fault, because healthy food helps reduce your risk for heart disease, but it really doesn't have a lot to do necessarily with your skin. Maybe if you had a really good anti-inflammatory diet, that might help a little bit, but it's not that a specific food you ate caused this specific outbreak. It's not that clear cut or that connected. So let's talk about things you can do. You can develop a regimen, and I want to tell you this. I tease teenagers because they expect immediate results, and they think if they wash their face with a new scrub or astringent or a leave-on that it's going to make a difference by the next day, and it won't. So I really want you to give it a 2-week mark. You can even mark it in your phone or on your calendar and say, in 2 weeks, I'm going to decide if this current regimen did enough good or if I want to try something new or different. Okay, so give it 2 weeks, whatever you do. If you just want to try them once a night to start with, that's fine. And I want to tell you something. Your pediatrician, we're always happy to see you and to help with acne and to try some prescription products. But I have had, in the last year or so, more pushback from insurance companies not wanting to pay for products because so many things have gone over the counter now. So let me tell you, it's perfectly fine to start with over-the-counter options. For example, in your evening regimen, you can try a scrub to begin with. If we can remove dead skin cells and exfoliate that top surface, maybe it will help those pores not become as plugged. So some sort of scrubbing wash to begin with. Then you can use an astringent. A lot of astringents contain salicylic acid, which would also help break down and remove any dead skin cells. And then you can leave on something after you've done that. Most of the leave-ons contain benzoyl peroxide, which is over the counter. When you're using benzoyl peroxides, remember to use a white washcloth and a white pillowcase because it will bleach the color from other items. I've had a lot of towels in my home that have had little streaks of bleaching, and it's just from that benzoyl peroxide. It's harmless, it just makes the towel look weird afterwards. So try to use white products where you're touching the benzoyl peroxide. Also, you want to start with a low percentage and work your way up so your face won't have too bad of a reaction to it. Some people will try for the leave-on to just leave it on the first night 15 minutes, then the next night 30, and then the next night an hour. And if they can tolerate that, then they can just leave it on throughout the night, and that's perfectly fine. Some of the prescription leave-on products include an antibiotic like clindamycin or erythromycin in combination with benzoyl peroxide, and the combination helps for the bacteria on the skin of the face not to become resistant to that individual antibiotic. And all those products are good. Let me just tell you sort of the upper limits. The super duper product against acne is the category of leave-ons called retinoids, like Retin-A. Well, there is now even a retinoid over the counter, which is pretty incredible, called Differin. I just want to make sure you know, try everything else before you get to that. That's sort of the ultimate, and it's pretty incredible to people who've been prescribing it for all these years that it's over the counter, because it's really very strong and a little pricey. And in the same way with benzoyl peroxide, you may want to start at first just leaving it on a few minutes, making sure you tolerate it, and as you build up some tolerance, then you can leave it on throughout the whole night. Now remember, none of those steps I mentioned contain a moisturizer, so it's a good idea to use a moisturizer if these products are drying your skin out too much. And there are several wonderful brands out there. I know in particular Cetaphil now makes an acne proof or an acne supportive line that's oil free, so you could try a Cetaphil moisturizer if your skin was getting excessively dried from all these products that you're doing to treat the acne, which is a common problem. Now, there are also some prescription meds that haven't gone over the counter yet that can be used by your pediatrician or your primary care physician to treat acne. One of those is birth control pills. We as pediatricians often get referrals from dermatologists to come back to us, their primary, to begin oral contraceptive pills, OCPs, or birth control pills. Not even because maybe the teenage girl needs to be on birth control pills for contraception or even bad period control, but just for controlling some hormones. And that can often help with her acne, which is an awesome side effect of those pills. And then the other thing is we will occasionally use a 2 or 3 month course of oral antibiotics, usually from the doxycycline family, like a minocycline that can be just taken twice a day. I have, for some reason, through the years, had a couple of weird things happen with that, though. It was 2 different occasions when I had a teenage girl who took her evening pill of the antibiotic for acne without fluids. She just took it dry. Well, it lodged in her esophagus and actually eroded through. So if you're taking any kind of nighttime medicine, but particularly that minocycline, make sure you're drinking plenty of fluids at the time so it doesn't cause any kind of erosion in your esophagus. So that's just an aside, but that would be a really big deal if you accidentally did that. Now, there is an ultimate treatment for acne, which is only saved for the very severe cystic, scarring, deep acne, and it's called Accutane. We would not even prescribe that as a primary care pediatrician. We would refer you to a dermatologist because it does have a significant side effect profile. Now, I've seen many cases of patients followed by dermatologists who did very well with it, and it made a tremendous difference in their self-esteem and their appearance and just their whole lifelong outcome of their skin quality. But it has significant potential side effects, and lab work has to be done routinely. If it's for a female, they have to be on birth control pills before using it because it can cause such extreme birth defects if she were to accidentally become pregnant. So it's a really big deal, but that is available. So I hope this has been helpful, just a general and quick rundown of the different medicines you can use for acne: salicylic acid, scrubs, benzoyl peroxides, topical antibiotics, oral antibiotics, retin-A products like Differin, and then ultimately potentially a referral to dermatology. So we would encourage you to try all the over-the-counter products first, and then if that's not successful, to see us, your primary care, and if that's not successful, we can refer you to a dermatologist. And remember to give each regimen enough time to actually work before you give up on it. And thank you for watching this, and I would humbly request that you like and subscribe. Thanks so much.